morning. I'd like to welcome you all to the October 2022 Heartland Continuum of Care General Membership Meeting. Hope everyone's well this morning. We have the minutes from July, and we need, if there are no corrections or any comments from that, the minutes will stand as presented. Are there any questions, comments? All right, thank you. We also need to look at our minutes from July. Are there any questions or comments on those minutes? All right, hearing none, those minutes will stand as presented. All right, let's jump in right away and what we've got going on. So Josh will talk to you about the final strategic plan presentation and our vote for adoption.
All right, I'm going to share my screen here. Well, this has been a topic of conversation for us for quite some time, and so we're excited to have a final version of the plan. The Continuum of Care Board has voted to adopt it, and today we're going to walk through it and then ask that you would do the same. So let me go into presentation mode here. We're not going to go too deep on any particular part, though I would welcome you to come off mute and say, "Hey, I don't know what does that mean," or any kind of questions you have. We can go along the way. So with that, I'm gonna actually 1 second here. I'm gonna make sure I pop up the participants windows so I can see if new people try to join while I'm talking. Okay. All right, there we go. Well, as you can see here, we're using this name of Heartland Housed as sort of the brand for the strategic plan, but there's also more to that we'll talk about a little bit later in the plan as well. And I think the other important thing, as we've gone through this process, the timeline for the strategic plan is 2022 to 2028. So we've got before us, a little bit of a 5-year plan to reach the goals that are reflected here. When you open up the document, you'll see all the partners who have sort of been a part of this process, whether they funded it or they served on the steering committee there on the early pages. And then following that are a few pages to really try to capture, some of the data, some of the need for the plan, and also the need for a new strategy. So the 4 strategies that really make up this plan and drive this plan are there on the front page. As well as the goal. Our goal is to reach functional zero, which would mean helping every person who's experiencing homelessness back into a housing opportunity within 30 days. That's where we want to be by the time we get to the point in time count in 2028. So the 4 strategies, I'll just mention them. Actually, we'll mention them as we go through, but they're there. And the goal of this first page is just really an understandable, brief summary of the entire plan. Some of what we know based on point in time count is that at any given time, there are roughly around 264 people who are experiencing homelessness in our community. And as we've done analysis, we anticipate that we will have 155 more people experience homelessness than our current resources are able to serve each year, unless we implement some of what this strategy is calling for. There's a lot of other data points there that are kind of reflected on some of these pages too. So I think these are helpful for you to sort of dig in and just to get a feel of this bigger picture of what's happening and who is experiencing homelessness in our community, as well as some of the struggles. So you'll see some information here about who accesses housing opportunities. A big emphasis of this plan is to say we don't have enough supportive housing opportunities for people who need them in our community, and that drives all kinds of challenges ranging from emergency shelter needs to day service needs to all of those types of dynamics that are made increasingly complicated by the fact that our system simply hasn't been effective historically because it's under-resourced. So the data tries to lay a lot of that out, and you'll see that there in the early pages. Connected to that too, we thought it was important to add this page about committing to do things differently, right? As a community, if we're going to be successful, we've got to be open to new practices. We've got to be open to best practices, and we've got to be willing to really expand operations, grow services, but also to create new services And then we're also going to need community support, right? It's not just we as a homelessness system or providers that need to do things differently. But if every time our agencies seek to do something differently and get shot down by the public, we can expect that that's going to create problems as the system tries to improve. Also with that is this commitment to equity. As we talked about and walked through, while we worked with Homebase to really kind of focus on building this effective system, we also worked with Latham Harris Inc. to really do an analysis of equity within our system, and to also put together a needs assessment about ways that we can improve. And so this plan was really driven by a desire to see equitable outcomes in our community. And so this commitment to do things different and this commitment to equity are upfront in the plan. From there, this page really is just sort of, again, we had that brief executive summary. This is kind of the next layer of that, right? So going a little bit deeper, you can see the vision that we've talked about in this group in terms of what we're really trying to accomplish. And then this goal, right? So this goal is to reach functional zero in 5 years' time, which for our community is going to be a heavy lift. There's a lot that needs to happen. There are a lot of new programs that need to be developed, and there's a lot of expansion that will have to happen in order for us to reach these goals. This graph down here sort of demonstrates, we talked about that 155 number earlier. If our community simply sticks with status quo, we can expect the number of people experiencing homelessness beyond what we have resources to serve to grow to the point of almost doubling in 5 years' time. That being said, if we can really get community support and buy-in to implement these new practices and new programs and new efforts, the black line demonstrates what we hope to see in our community. The 4 strategies, I'll actually read through them here, and I'll read through these highest priority action steps, and then then quickly we'll sort of show you the 4 strategies in more in depth, but I won't read every page to you. So the 4 key strategies. So this is going to be incredibly complicated and difficult. How are we going to do it? The first one is to create safe, effective housing opportunities. The second strategy is to improve the effectiveness of the homelessness system. The third strategy revolves around coordinating with other systems of care to reduce homelessness. And the fourth, the community works collaboratively to address homelessness. So to some degree, these are self-explanatory, right? That first one, that's where we see this high priority action step of creating 765 more permanent housing opportunities. That's really reflected in that first strategy. What do we need to do that? Well, we need to hire a person who's going to help oversee that effort, who's going to help us go after more grant funding, more developments, more relationships with landlords and those types of things. And then, we need support, right? We need rental subsidy support. We need support to hire new case managers, all of the things that are needed to create successful supportive housing outcomes for people. That's what that first one is really about. The second one, is really about, taking a hard look at our system, where the gaps are and where there needs to be improvement. And some of that is adopting practices that we see working elsewhere. Things like really building out an effective diversion program and increasing resources for diversion so that we can do a better job of preventing people from experiencing homelessness, right? So connected to that goal of reaching functional zero is creating a system where homelessness is rare, brief, and non-recurring. And so the improvements to the system are really with that in mind, right? How can we prevent homelessness and pull together the flexible resources to do that to every degree possible? When a person experiences homelessness, how can we make sure that we have effective crisis housing, which would mean, emergency shelter, transitional shelter, an opportunity to make sure a person has a safe place to lay their head while they work on moving towards a housing opportunity. And then again, brief, right, would sort of be creating those housing opportunities so that as street outreach workers and other people in the community are engaging folks, they really can talk about coordinated entry, not as just a list where maybe you'll get housed in the next couple of years, but hey, our goal is to get a person on coordinated entry and then support them into housing within 30 days. We've got a long ways to go there, but as resources become more aligned with that, it creates new opportunities for that system improvement as well. This third one, coordinating with other systems, has to do with discharge planning. There's a concept in there around bridge housing. So if a person is exiting a hospital or another system, ensuring that there might be some appropriate beds available for them in the community. And so really working collaboratively across different systems, where often those transition points could be a point where a person might experience homelessness. And again, I think that feeds into prevention in an important way. And then the fourth one, the community working collaboratively, this one is really about infrastructure. If we're going to reach these goals, we really need system leadership that's going to help facilitate all of this. So part of that is creating a lived experience advisory board with the goal of incorporating people with not just lived experience, but helping them to develop lived expertise as a way of helping to improve the system and compensating them for their time. Another big piece of that is the development of a strategy board. I'll show you more about that in a few moments. And then another part of that, we talk about Heartland Housed as sort of the brand for this strategic planning effort. We're also working to stand up a new entity that will be called Heartland Housed, which is where the system leadership staff will be employed by. So part of the plan is for that incorporates, working with the city, the county, and Capital Township to fund the staff needed to provide system support and system leadership so that we can effectively reach these goals. So that's a lot there, but that's what these highest priority action steps are really focused on. Now, if we look at the plan itself, and again, we're not going to go too deep into this, but I just want to, just in case you haven't done a deep dive into the plan lately, I just want you to know exactly what's there. So with the first strategy, they're creating those housing opportunities. For each one, there's the goal. How will we measure if the goal is successful? And where's the energy going to come from, right? Who's going to oversee this? This housing task force would be a new group that's developed, and this housing development coordinator would be a new person we would look to hire to oversee that in our community. If you're curious, where in the world did we get that number of 765 and what does that look like? This chart down here really demonstrates that. And so you'll see, even when you look at this graph, right, from 2022 to 2023, we don't see improvement, right? So there's time to kind of ramp this up. And then as we get these efforts going, we expect to see improvement in the system. And then when you look down here at the breakdown of that, this will sort of show you how those numbers sort of work out to help us get to functional zero and how we came up with that 765 number. The breakdown of that 765 between rapid rehousing and permanent supportive housing, you can see that with an explanation of it here. And these action steps then really kind of go more in depth into what I was trying to give you a summary of there. There's obviously, given where we are as a community and where we need to get, there's a lot packed into each of these strategies. And I think it's important for you to read through those and really wrestle with them. Strategy 2, again, improving the effectiveness of the system, the goal, the metrics, who's going to lead that effort. Within this sort of new structure that we're creating with the strategy board, working with the Continuum of Care board, the Continuum of Care board, the strategy board's development, I guess I probably should wait to talk about that, but it really frees the Continuum of Care board up to really focus on implementation, right? So it helps us simplify their work and focus it some. And so you'll see that really reflected in the strategy. And again, a new staff person will help to facilitate the goals reflected in this strategy. I think it's important too, when we talk about these housing opportunities, do they work? And what we've seen in our community, permanent housing retention was 99 in 2020 and 2021, and that's up from 2018. So the reality is, not only is this working elsewhere in the country, it's working here too. The organizations that have worked to ramp up these programs have grown in their capacity to do it, and they're really effective. And so an investment in our organizations that are creating these permanent housing opportunities is a great investment in the solution to homelessness. There's a little breakout here. I think when we talk to the community and we talk about housing opportunities, some of the feedback is, well, you can't just put a person in housing. And the reality is that's not supportive housing. That's not what we're trying to create. And so what is a case manager, and what does the case manager do? You see that reflected there on page 15. Strategy 3, again, this is really that cross-system collaboration. You can see the goal, the metric there, and who's going to oversee that. This would be the staff and the strategy board there, and the staffing person associated with that. And then some of the different systems are more spelled out here, right? The healthcare system, the public safety system, workforce development. All of those are key parts of those different collaborations we need to build. And then the fourth strategy around that real infrastructure piece, you can see some of that here. Some of that involves, to grow programs, we have to grow funding, and so that's a big part of what the strategy board and this Heartland House staff is tasked with doing. We've got to expand the resources available to our organizations to expand. Here, I talked about the Continuum of Care board being freed up to focus a bit more on implementation. You can see that reflected here in this graph in terms of who's going to do what, how is this structure going to work is there. And then this breakout here on page 19 is the new staffing configuration. So in our community, we have an HMIS administrator. Mercy Communities is the HMIS lead and has had that role for over 10 years now. So that's a staff position that already exists in our community that this will help provide ongoing support for. My role as the coordinator is sort of reflected in these different positions. And then housing navigation, that's a role that we've had in our community for about a year now. New roles would be administrative and communication support for this team, this housing development coordinator that we talked about in strategy 1, and the implementation crisis response coordinator that we talked about in strategy 3, I believe that was. So there's additional staff, additional energy that we will be seeking funding for to help make sure that this isn't just a great plan on paper, but there's real system leadership into helping bring these things to fruition. Okay. An idea of like, what's this going to cost? What's it going to take? And where might some of that funding come from is there. And then again, some of the action steps, needed to help reach those goals are there as well. That gets us to an appendix. There's just a little bit more information. The first page is around that strategy board. Some of the commitment there is around equity, ensuring that at least a third of that board reflects people who are overrepresented in the homelessness system. And then you'll see just some of the different support and agencies that will be reflected in that effort. And then on page 23, as a visualization to try to help you get a feel, okay, there's new pieces coming into play here. How will this all work together? How will the staff support all of that? That's what page 23 tries to help you conceptualize. And then a little bit, obviously, we use way too many acronyms. And, I think most of the time people just like, I don't know what that means, move on. We tried to capture a little bit of that here in the appendix as well. Then a thank you to the steering committee and again, the organizations that helped fund the support, and Home Base and Lathan Harris Inc. who helped us put it all together. And that.
All right, thank you, Josh. Are there any questions? I mean, that was a lot. There's a lot to be presented. Hopefully, if you haven't had time, you'll find some time here in the very near future to review everything. If you have any questions at all, you can send an email to Josh or hold questions to next month. Are there any questions at this point?
Hey, Josh, this is Juan. Can I mention something that we can add to the plan at this time or not?
I mean, you can mention it. The plan is finalized, but you're welcome to bring up any thoughts you have about it.
Okay, thank you. I think that after the city talking with Ryan McCready, and we were wondering if we can add a day center to the plan. No day services, a day center. Because I think Ryan came from Decatur, and he stated that ever since they opened a day center, things were much better in Decatur.
Sure, there is
and feel free to call Ryan McCready if you would like.
No, yeah, we're very, very familiar with Decatur's efforts and and Ryan's involvement in that. And there is, so within the strategy around ensuring day services, there's capacity for that. So not saying, hey, let's just throw in a day center, but let's really analyze what the need is. And again, a big part here that, I think this conversation sort of illuminates that, right? We have this immediate need in our community for adequate emergency shelter that meets needs. We also have this need to shift funding to some degree from continuing to build emergency shelters to building housing opportunities if we're going to create the system. And so,
Yeah.
so we're not going to rush into saying, hey, let's spend $3 million on a day center when $3 million could create a significant amount of the permanent housing opportunities needed to get where we're trying to go.
I didn't say that, Josh.
I didn't say you did, but that's
Okay.
an illustration of where we're trying
Well,
to.
I just want, since we're recording this conversation, I want to go on the record
Mhm.
telling you that we need to put something in the plan about establishing a day center. So I just wanted to go on the record that today I told you that. Thank you.
Yep, appreciate
Thank you.
your
Thank
insight.
you, Juan.
Thank you, Val.
Uh-huh.
Bro, you do too.
Thank you.
I haven't seen you in the last couple of days.
Yeah, no kidding. We kept running into each other like, what, 3 days in a row? So,
Yeah. It's your lucky days, Val.
oh, I was thinking the same thing about you, Juan. So,
All good then.
all good. All
Okay.
right.
Well,
Any
thank
other any
thank
other
you.
comments?
Thank you, Josh, for taking those notes.
Okay, Jeremy.
Hey guys, how you doing? Hey Josh,
Uh-huh.
nice to see you again. Here at Land of Lincoln Goodwill, I've noticed a trend with our employees from Express, and they're coming in my office and they're asking for housing services. But the trend that I'm seeing a lot of people who are living and staying in motels. And when I fill out a lot of the applications, I'm seeing how much they're paying being at these motels, upwards to like $1,000 or more a month.
Oh.
And what I'm seeing is that it appears to be predatory, but they don't seem to feel like they have any other options. So they're paying week to week, staying in these motels. I love the plan. I love what you guys are putting together, and I love what's coming. My question is, with the supportive services, how can we get these folks to understand that they have a better chance of coming to you guys and into the shelters to be able to save? Because it's not always that they don't have the money to find a place to live. They have it. It's just going to the motel. It feels like a payday loan. What can I do? What can I say to let them know that they would be better suited being in the shelter, saving their money, than throwing it at a motel?
Yeah, I mean, that's a fantastic point, and I think something our organizations, likely see a lot as they do intake. And to me, that illustrates the need for that housing navigation and that prevention and diversion piece, right? So for, because even now there's community resources available, right, that might help a person, get perhaps a security deposit or a first month's rent, but maybe they just need that help to try to find a unit. And so.
Right.
That's where that housing navigation piece is possible too. So when we talk about building out this diversion, this housing problem solving type of approach, part of what we would do in the first year implementation plan, because there's a lot of loose efforts sort of in that direction. In year one, we would really seek to pull those together in a more cohesive way, but also to add resources, right? So diversion resources, where in your situation you would be able to say like, hey, there's reach out here, the housing helpline, or another resource, and see if they can't help you find a better living accommodation. Or so while I think now housing navigation, reaching out in that regard, and I'll be happy to kind of connect with you about that.
Thank
Could
you.
be a good connection point, but then that'll be a point of growth really to sort of staff that, to meet the need in our community moving forward.
Appreciate that.
Yeah, and Jeremy, I was just going to say, and to Josh too, that's a great connection point for us. You're a perfect advocate for us. So we need to do a better job of communicating with you, helping you understand and helping you feel comfortable making those recommendations. We want you to feel good about each time that you can say that. So thank you for bringing that up.
Oh, no problem. Thank you.
Mhm. Anyone else? All right, Joshua, would you like for me to call for, or is there anything else you want to add, or shall I call for a vote to adopt the plan?
Yeah, I think a vote sounds great.
Okay, may I have a motion to adopt the plan.
I'll make a motion to adopt the plan.
Thank you, Penny. May I have a second?
I'll second.
All right, thank you. That was Dave, right?
Yes.
Okay, thank you, Dave. All in favor signify by aye or a thumbs up.
Aye.
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 Any, any opposed? All right, motion passes. Thank you so much. This has been quite the long process. Josh has put in hours. The team that has worked on this has put in an incredible amount of time, and we're very, very grateful for this and really looking forward to implementing this in our community. All right, thank you. Thank you, Lingling. I appreciate that too. All right, Josh, well, you're on a roll, so let's talk about the HUD grant, which are you done? Have you submitted, or is that today or
We will
tomorrow?
submit the special NOFO at 2 o'clock today.
2 o'clock, okay, right.
And that's really, I just wanted to mention to everybody, if you go to our website, there's a grant page there that explains, what projects were funded and all that type of stuff. So if you're curious to see that, well, I should say not necessarily what projects were funded, but our application, our request for projects to be funded or can be seen there. And just a reminder that the special NOFO was an entirely new opportunity for our community. And that grant request includes over $500,000 over a 3-year period for permanent supportive housing and rapid rehousing. So it's something we certainly, it's a competitive process, and we really hope we get it, but it could be a great source of growing some of these programs. So so more than anything, just an update there to say that the information is out there on the website. Also, if you have had an email to me in the last month or so and I haven't responded, don't hesitate to just bump it back up in the inbox. So
Yeah, he's been slightly occupied otherwise. Yes, thank you. All right. Do we have any agency updates? Laura, I don't want to call you out, but I know since this team has met, you've got an update from Helping Hands on your appointment.
Yeah, thank you, Val.
I guess I should have just announced it, right?
No, that's okay. So, so last month I was appointed as executive director. The other exciting thing we have is we should be breaking ground on the new housing development next month. So a lot going on.
All right, thank you. Any other agency updates? Jazz? Yeah.
This is Jazz with Land of Lincoln, and I just wanted to let everyone know we have made a new hire, actually I think it was probably like right before the last meeting, but we have a new housing attorney-ish. She's also getting licensed in November. Her name is Jerica Griffin, and she's actually going to be focused on housing. So she'll be working with a lot of people here, and anytime we have some sort of collaboration efforts with other agencies here, she'll probably be one who's involved with that. She is on the call, but I don't know if she's able to pop her camera on.
A heads up would have been nice, Jazz. Could have said, hey, I'm about to introduce you to these people.
I didn't realize we were already to agency updates. My B.
Hello, everybody. Here I am. Nice to virtually see and meet everyone.
welcome, Jerica. Thank you for joining today. And
Thank you.
Thank you. All right. Thank you, Jess, for that introduction. And thank you, Jerica, for joining us today. We'll look forward to hear a lot more from you. Are there any other agency updates?
Hi, this is Susan from SHPA.
Hi,
And
Susan.
great to see everybody again. I just want to tell everybody that we will be hosting a Telling My Truth workshop, which is for persons with lived expertise who are currently living in permanent supportive housing. Want to give a huge shout out to Helping Hands for, all of their help with facilitating, setting up the location and times and everything. Great shout out to Nick too, Nick Dodson for helping with all of that. But that will be starting September 25th. And I just am mentioning it because if you have anyone living in permanent supportive housing who would like to share their story of truth and learn how to do so in an empowering way for potential advocacy in the future, we have openings still for this workshop. And I will drop my email in the chat and we can discuss that a little bit further. Something we're changing up about the workshop is we're first holding a listening session with residents of permanent supportive housing, whether or not they want to participate in the workshop or not, to gain a better understanding of what advocacy efforts persons who live in permanent supportive housing could potentially advocate for. So when we're talking about, advocacy at the end of our workshop and how we can use our stories, our stories of truth for empowering, ourselves and for advocating for efforts, we know what we need in our area. So I will be reaching out to some of you because some of you know that at the end of the workshop, we do have an advocacy day because we want to let everybody know of what advocacy opportunities or just what opportunities to serve on boards and committees for persons with lived expertise. So we'll be giving you that date and probably begging you to come and attend and tell us a little bit more about those opportunities. So if you have an opportunity for persons with lived expertise to participate in a board or committee or any type of effort that you have going on with your agency, again, please contact me and I'll stop talking now. Thank you for the time.
Do you have a time yet, Susan, on October 25th? Do you have a time?
Yes, we do have the time and all the details. But I would really love for people to contact me so that
Okay.
we can kind of gauge the amount of people involved. And because we're going to be trying to provide lunch and that I would love for it to, just be a public listening session, but we're trying to make it more of an intimate gathering so that we really hear in a safe space and in a nurturing way, what's on the
Sure.
inside and what we really need to hear from those folks.
Okay, thank you, Susan. Appreciate it.
Thank you.
Mhm.
Add to that real quick. So we're grateful for you and SHPA. I know, since the spring, you've been working on helping to pull this together. So thanks for your efforts. And then just also wondering if you would include like a few lines in the chat for the agencies represented here, we'd also send that out to the general membership with your contact info to get connected to you.
Oh, sure. I'll drop my email and my contact information in there. So if anybody would like that, they can also, contact me. Trying to think of an easy way to contact me too. You can go to SHPA's website too if you're not able to grab it from the chat. All of my information's on SHPA's website too. It's very, very easy. So
Thank you. Any other agency updates? All right, we're having the first youth homelessness task group meeting October the 27th at 9 a.m. This group came out of there was a youth homelessness summit that was held, I think it was like the very end of August. And that was a fantastic opportunity for a lot of people to get together. So out of that meeting came this group that's going to start meeting. Katina, do you want to add anything more to that? Nope. For some reason, sounds like your audio's not working. Josh, do you want to, is there anything more you want?
For anybody interested in joining, in the general membership email, there's a link. I'll pull it up real quick and throw it in the chat. That would be a way to get on the invite list for that.
Okay. Thank you for your attempt, Katina. Appreciate that. Thanks, Josh. All right, our next Continuum of Care General Membership meeting, the annual meeting will be November 17th at 9 a.m. Are there is anybody else have any comments? Anything else they'd like to say other than Tracy, you want to remind us of the meeting after the meeting? No, you don't want to?
No, because you just did. Anybody who knows knows.
Okay.
Kind of early though, so we,
Oh, yeah, no kidding. We
it's
did
usually
whip
at
right
about
through
10
that.
o'clock. So
Yeah, yeah. All right. Josh, anything further?
I don't think so. Just, I guess one note, next Friday morning, a group of us will be making a presentation to the Citizens Club about the strategic
right.
plan and some of those things. So if you're interested, you could attend, participate, or watch online afterwards.
When is it? What day, Josh?
It's
Next Friday,
The
which would be the 28th.
Correct.
and who's going to be speaking besides you, Josh?
It'll be myself, Ricky Reese, and Jonita Johnson.
Okay. Who's Ricky Reese?
Ricky Reese is a person who's been a part of the steering committee to develop the strategic plan.
With lived experience.
Okay.
Mhm. Okay, and also, just so you know, the strategy board will have its first meeting at the end of this month also, so we should probably have some kind of report for you the next month too.
Yeah.
I have a question. Josh.
Jane?
Josh, do we mention anything about what the committee's been doing?
Do you want, go ahead if you'd like to.
Yeah, go ahead. Yeah, Jane.
The Community Education Committee has been working on a strategic plan training similar to the community ambassador training. And it looks like we'll have that ready to go next week. And we're going to print postcards again with the QR code and links and stuff. And Nick Dodson and I are going to pass them out at the meeting on the 28th for Citizens Club. So.
Oh, that's a perfect plan, Jane. Thank you. All right. Thank you, everyone, for attending. Can I have a motion